Great to see that back open, Eileen. Thank you so much for that. As part of our follow-up series tonight, there is a bill on the table in Albany designed to ease the nursing shortage here at home. State lawmakers want to partner with Western New York hospitals, universities, and nursing unions to get students through training programs and into the workforce more quickly. The nursing shortage is a well-documented problem in our region and across the country. Our hospitals routinely hosting on-the-spot hiring events to get more nurses into their facilities. But a nationwide nursing group reports school enrollment is not growing fast enough to meet demand. The AACN predicting there will not be enough nurses joining the workforce over the next decade to fill the job openings. So I went to a meeting between local healthcare stakeholders today where a possible solution topped the agenda. It involves simulated training.
Why do you keep saying that? Oh my God, you're having a party here?
This is video showing a patient in the hospital trying to escape. It is used for training to show nursing students what could happen in real life. Healthcare professionals, nursing schools, hospital representatives, and assembly members gathered at Trocaire Thursday to talk about a potential solution to the critical nursing shortage. It involves simulated training for students.
But what we know is that one of the reasons that there's a shortage, there's a plethora of students who want to get admitted into nursing school, but nursing schools have to turn them away because the number of nurses is limited by the number of clinical placements that they need to get in order to graduate.
Assemblymember Monica Wallace is proposing legislation that would allow nursing schools to use technology and substitute some of the required clinical learning with simulated training.
And so this gives them the opportunity to do it, make their mistakes in a controlled setting, and then go out there and take what they've learned and do it on a real patient in a real environment. And technology has improved so much that, they now have mannequins and so forth that the students can work on that will let them know, for example, they've properly drawn blood.
Because we're obligated by New York State Office of the Professions to have those clinical experiences. If we don't have access to those clinical experiences, obviously then we can only accept so many students.
The president of Trocaire College tells me simulated training would make it possible for his school and others to train more students faster. Is Trocaire ready to implement those simulated experiences?
Yeah, absolutely. So we have been using simulation for practice with our students for several years. The challenge is what we've wanted to do is to be able to construct the simulation experience to go beyond a practice session and actually substitute for some of the early clinical experiences that we now send people out for and are having difficulty finding those.
Now, he also says if you are thinking about a career in nursing, start by calling around or looking online at different schools and finding out what kind of financial support or incentives they offer. There are a lot of them out there right now. He also says some employers will help you pay for nursing school, and in some cases, they're offering signing bonuses. Trocaire has a scholarship it established during the pandemic, if you want to look into that as well.